Now they're banned in Scotland. Labour pledged to abolish them elsewhere, and the Lib Dems have described their use as an affront to basic human dignity. Mixed gender wards are highly controversial, and back in 2013, the Health Secretary, Jeremy Hunt, announced that they'd been virtually eliminated in England. Yet, despite this, BBC News has found that in the last year alone, men and women were treated in the same room around 9,000 times. That's almost 3 times the figure from 2 years ago. John Maguire has more.
Good morning, everyone. We are here now to hand over our patients.
Every morning, staff at Yeovil Hospital meet to plan the day ahead to determine what care the patients receive and where. Treatment and recovery are, of course, paramount, but separate areas for men and women are an important factor here.
So this is Ward 6A, which is our elective orthopaedic ward. Here we have bays of men and women, which have the toilet and bathroom within the bay, which means that if you're in a male bay, you can use the bathroom within the bay and don't have to travel between the two. Okay. We also have side rooms where you can go if you either need specific kind of care, or if we can't accommodate you in a male bay, we can use side rooms so you still have that privacy and dignity there.
For the past 6 years, NHS hospitals in England have been fined £250 if a patient is in mixed accommodation. There hasn't been a breach in the system in Yeovil since September. Here in the hospital's operations room, they monitor real-time information on patient admissions, discharges and whereabouts.
We know that if patients are nursed by the right people at the right time in the right place, that actually their length of stay does decrease. Right. And their risks to staying in hospital are minimised and reduced.
In 2013, the Health Secretary told his party conference that mixed-sex wards had virtually gone. The first time the breaches were measured was in December 2010. That month alone, there were 11,802 cases. The new government policy saw the number drop markedly. At its lowest point, it was 2,431, not per month, but for the whole year in 2014. Since then, though, they've risen. The latest annual figure was 9,003. Mixed-sex wards have been banned in Scotland for 12 years, and in Wales, rules state separate facilities should be provided wherever possible. Neither publish their data centrally. The breaches increase when hospitals are under the most pressure. Figures for mental health trusts are far lower as there are fewer hospitals, but the health watchdog, the Care Quality Commission, found some hospitals in the sector are not following the rules. This woman has bipolar disorder and was placed in mixed accommodation when she was admitted. She's asked to remain anonymous.
I've had incidents where males have tried to pursue me, pushing notes under my door. With shared bathrooms, shared lounge facilities and dining facilities, there's no way you can be private as a female, especially if the males are unwell themselves, following you around and encouraging you to leave the ward with them. That's my experience, being encouraged whilst unwell to escape the ward.
The figures only measure beds, not shared bathrooms or other rooms such as lounges, so campaigners argue the problem is underreported.
If there's just one person who's in a mixed-sex setting where their privacy or their dignity is compromised, or where they feel unsafe, or where indeed they are unsafe, that's one person too many. This is the 21st century. We ought to be able to provide, at the very least, a setting for somebody that's safe and therapeutic.
Smaller bays of beds or single ensuite rooms are becoming more commonplace. The health regulator, NHS Improvement, says it's supporting the commitment to reduce the number of people treated in mixed-sex wards, and any rise is obviously disappointing. But the pressure to cope in extremely busy hospitals means beds of whatever type will always be in high demand. John Maguire, BBC News.